So where do you see AI coming into urology? How do you see future?
What is AI actually? AI will replace it human.
बहुत से डॉक्टर डरते भी हैं कि मेडिकल फील्ड में ज़्यादा AI होगा तो हमारा यूसेज कम हो जाएगा. बहुत ज़्यादा रोबोटिक और AI मिलकर डॉक्टर की ज़रूरत ही ना हो.
People are always frightened.
Yes.
You cannot escape this change. You cannot ignore this change. The computer may be wrong even in 1 in 5 cases, but it is better than the human. Does it have an idea of how to perform an X-ray? AI को सिखाएगा कौन कि भाई ये नए टाइप का X-ray
लगता है नेचर ऑफ जॉब विल चेंज बट
doctors will use more and more of
AI.
And the one who is using AI will perform better than one who is not using AI.
Correct. So where do you see AI coming into urology? So one of the common question is about the AI in healthcare.
Yes.
काफी AI तो हर फील्ड को टच कर रहा है. When we are discussing about urology. So where do you see AI coming into urology? How do you see future? And बहुत से डॉक्टर डरते भी हैं कि मेडिकल फील्ड में ज़्यादा AI होगा तो हमारा यूसेज कम हो जाएगा. So how do you see? One is using AI in urologist, and second, what are the fear? Is the fear of urologist is true that बहुत ज़्यादा रोबोटिक और AI मिलकर डॉक्टर की जरूरत ही ना हो शायद फ्यूचर में क्या ऐसा सिनेरियो डेवलप हो सकता है?
Yes. So AI, I think that if you look at the history and what over generations has happened, every time any new thing has come, as for example, you take a computer, people are always frightened of what is happening.
Yes.
So in that way, I think this is a big leap into technology. Maybe le lo ya jo bhi le lo, but it's a big leap. And you know what? Throughout these changes, I've always seen that you cannot escape this.
Correct. You have to embrace.
So you cannot escape this change. You cannot ignore this change. You have to accept it. You have to embrace it. ठीक है. अब AI will replace it human. So I had a good discussion on AI with few of the people who are very very much into Microsoft AI and Google AI and all those things. So what is AI actually? It is not a computer who is thinking. A computer who is generating some ideas from anything which has been stored into it. And it has been trained to bring that. See, as for example, you are getting your X-ray done. ठीक है ना? X-ray आप देखा, a doctor is seeing, what are the chances that he might be wrong? What are the chances?
Depending experience.
Exactly. You take an experienced doctor. Even then, human error is always there, 1 in 10.
1 in 10, yeah.
Yeah, that's a human error. Suppose the same type of X-rays, 1,000 pictures, we fit into a computer, ठीक है ना? And then ask a computer to predict where the actual disease is. So the accuracy may be 1 in 5, He may be wrong, the computer may be wrong even in 1 in 5 cases, but it is better than the human. So does that mean that radiologist will lose his job now? No. See, AI is not going to develop a technique of doing the X-ray. It has only, maybe it has only 1,000 years after that. I don't know what is going to happen, but it has only capability of reading the X-ray,
analyzing the data.
That's it. Does it have an idea of how to perform an X-ray? Does it have an idea of in which position to perform the X-ray? Does it have an idea that which type of X-ray will be required in this patient? Number one. So in that way, humans should not fear that AI will replace them. Number two, data. You train an AI. As we know that lots and lots of malpractices are going everywhere. So suppose someone generates an AI algorithm for reading an X-ray based on 100 X-rays. Someone may generate it on 1,000 X-rays. So and someone may generate based on 10,000 X-rays. So which one will be better? It will be the one with 10,000 X-rays.
10,000 X-rays.
So what is the use of AI? Ultimately, AI is only speaking what we are entering. It is analyzing the only data which we are entering. Suppose a new disease comes up. So I know there are 10 types of stones which can occur in urology. Can an 11 type of stone never occur in him?
नहीं सर.
अब किसको पता है? ये तो देखो बीमारी तो रोज बदल रही है. रोज बदल रही तो AI को सिखाएगा कौन कि भाई ये नए टाइप का एक्सरे है, ये ढूंढो. तो क्या डॉक्टर्स की जरूरत नहीं पड़ेगी?
मे बी नेचर ऑफ जॉब विल चेंज है. मुझे लगता है कि नेचर ऑफ जॉब विल चेंज बट
doctors will use more and more AI. And the one who is using AI will perform better than one who is not using AI.
Correct.
We can say that, okay, that's very fair, because if I'm calculating manually and if I'm calculating with a computer, obviously the one who is calculating with the computer is fast.
Correct.
And that is one big thing. So did the invention of calculators or computers made the one accountants extinct.
नहीं अभी
नहीं।
तो और भी काम है
They
उनके
are
पास।
using
Smart
the-
हो गए, accountants और smart हो गए.
वो use करने लगे.
Exactly.
हाँ।
So that is the way. AI is never.
So AI is never going to replace doctors, but the people who are not learning or upgrading to the AI, those doctors may get replaced.
Exactly.
Yeah.
And even robotic, you talked about robotics.
हाँ,
ठीक है ना? Robotic technology, robotic is coming into anything.
Hmm.
But ultimately, like, through this August audience, I would again like to enlighten. Robot never performs a surgery.
Hmm.
He only takes commands
Commands and instruction, and then
which are very precise
Hmm.
and up to the mark as given by the doctor.
Hmm.
So ultimately, it is decreasing fatigue of doctor.
Hmm.
It is increasing the precision to
Precision.
perform. Someone may have tremors
हाँ.
and still he wants to perform.
Hmm.
He can sit on a robot. This is what someone who is having tremors,
Hmm.
who can sit on robot and perform surgery without having tremors.
Hmm. Absolutely correct. So
So-
enhancement हो गया.
Exactly. So again, AI is bringing enhancement. It will never replace.
Awesome.
This is what I feel.
Great. So good take on AI.